some of the dumbest stuff that people say about TRT.
Welcome to this channel. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please subscribe and hit that notification bell.
300 total is normal for a middle-aged guy. You're 45. I guess I'm middle-aged now, right? I'm 46.
Yeah, that
Am I
makes sense.
middle-aged?
Yeah, I'm 40,
Shit.
so that hurts me.
Yeah. So I should have levels of 300 because it's normal, and not do anything about it. Doesn't matter how I feel because my levels would be normal.
Yeah. Normal for who? Though that's the thing. Normals are just based on a population that's getting, like I said, they're getting less healthy. I know people have debated that, like, oh no, they looked at these guys. You know, we posted that study where they got these new normals from, and it was just kind of pathetic how they got them from a huge cohort of guys, but then they whittled it down to only like 100 from each study, and then tried to normalize it with some factor to make the lab look better. But if you looked at the baseline, they're calling the guys healthy, but you read that their BMIs are higher, they're smokers. Like, look at guys in general across the world. They're not healthier now than they were 30 years ago. They're not in general. Everybody more sedentary, lots of smokers, lots of environmental factors, pollutants and all that. So we're not healthier. So you can't, it doesn't matter what the normals are for guys nowadays, you know, and that's why you got to go off symptoms more than anything. I think it's not just about the numbers. I mean, we know that guys in the 300s usually don't feel well. We just know it. I mean,
Yep. I sure as hell didn't feel well. I was at 227.
Could there be guys in the 300s that feel well? Sure, there could be. Like I say, at some point you get to a low enough point where it becomes a health risk, and that's where I get concerned. If I test a guy and he's at 200 and his E2 is like 8, he needs to be on replacement. It doesn't matter how he feels, honestly. He's probably just gotten used to feeling like crappy for a long time.
Yeah.
So yeah, that's just silly.
Guys, stop following anything that you've been told is normal. Just don't.
I mean, I hear it all the
Find
time.
an amount that makes you feel
the
better.
new normal's down to 200 or on some labs. It's like, or 186, I think it was the VA or something. I was like, that's insane that a doctor would check you and you're at 187 and they go, nope, you're normal.
God. I got told LabCorp is dropping their ranges again this year. That the high end of normal is going to be 800 and something.
Doesn't surprise me at all. Yeah, they did a recent study. It's not even, I don't even know if it's been published yet. I read it. It was a Journal of Sexual Medicine. They got some new averages for guys 20 to 39, and it was basically 400s was average.
That's
like,
it.
That's low. That's low.
So everyone go to your doctor now because you're all above range, all of you. So make that appointment for the yearly. We got to lower your dose now because the new normal came out, and you have to be normal just like them, right? Ugh. The next one. You want to see Jordan Grant get red?
Uh-oh.
The next thing. Ready? You need an AI.
Do we even need to discuss this?
See, look, he's getting red.
Honestly, if guys at this point haven't, I mean, I understand they haven't seen the video, but you at least watch the video that Danny and I did. I think it was a very good video. Not that I did anything good, but it was just, there was a lot of information covered. I think the files that we posted were very comprehensive. There's always, you could add more, but if you truly want to understand estradiol in men, you got to watch the video. You got to look at the papers. You got to. I mean, if you only look at one paper, look at the one entitled Estradiol as a Male Hormone. It's excellent because it's got all the references in there to a lot of the other papers we posted. It's mind-blowing when you start looking into this stuff. And if guys can't get out of their heads this blood level of E2, they're never going to get over this idea. Yeah. Or if they can't get past the fact that we aromatize. Like I hear guys saying, oh, if I'm aromatized and I need an AI, I'm like, of course you aromatize. That's how you make estrogen. That's how you make your estradiol, is aromatization. I mean, where else do you think it's coming from? So you have to understand that stuff, though, before you can start making these statements. You know, there was a guy recently in the group talking about gyno. He just kept focusing on the estrogen part of it. And you know, bodybuilders and all this stuff. And it's like, dude, bodybuilders get gyno all the time when they're blocking their E2. They get it all the time, depending on the compound they're taking. There's a misconception that taking more testosterone leads to higher and ever increasing E2 levels. It doesn't. We talked about that. I posted that paper. We got into it on the Facebook group a few weeks ago with somebody on there about that. I mean, there's been only really one study done showing that, up to levels 600 milligrams a week, and they plotted out the serum E2 levels, and you could see that they taper off as the testosterone kept going up because you're saturating aromatase. Again, the serum levels aren't even what's driving the tissue action. There are tissues where the E2 levels are magnitudes greater than that blood level because that's what the tissue needs. There's also tissues where that level, the tissue level is lower than the blood level because that's what the tissue needs. When you block estradiol conversion with an aromatase inhibitor, you block it everywhere in all those tissues. So you have no way of knowing what you're doing to each of those tissues. You're screwing up, every tissue that needs that in a certain amount. So you got to understand that estradiol is made in the cells. What you're picking up in the bloodstream is just minutia compared to what's being made in the tissues. So you cannot say, I need to keep my E2 20 to 30. You can't. You just can't. And all these studies that have the normal values of E2 in men are not based on men on TRT. So it's not applicable. Anyway, we just watched the freaking video. We've watched the freaking video. We have beaten that horse into a bloody pulp. So it just gets old. I mean, I understand guys are coming into the channel, but that are new, just at least watch it, and then you can make an informed statement about it. But don't just come on here blasting that my E2 is too high if you haven't at least looked into it. So.
There was a guy that commented actually on that thing, and I actually deleted the comment because it was just dumb. He said these papers are outdated and there's new science that says you should be controlling estrogen. And I said, show me the new science. I'd love to see the new science because this will be great. I haven't found it. Meanwhile, nothing.
No.
So a couple days pass, nothing. Bye. Like, no, you're just making a claim that you can't even back up or demonstrate. It's useless. It's just nah. Yep. Drives me nuts. And then you got these other guys on these YouTube channels that just every second video is about estrogen, and how you need to control it with microdosing with whatever nonsense AI they're taking. It's just
yeah. I mean, it's not based in any evidence. It's not.
None.
And look how many guys. I mean, this happens every week in our group that we take, and they say the same. It's the same thing. They all say the same stuff. And you start telling them about this little by little, and they're like, no, I have these symptoms. If I don't take my AI, I know that it's E2. I mean, it's almost every guy. And then when I get them to stop their AI, and a month or two later, they're like, I feel better than I ever have. It obviously wasn't my E2. I'm like, yes. And it's repeated over and over, but people still just don't believe it. I mean, talk to these guys. And that's why I think we do need to make a little montage video of just all these guys from the group giving a little 1-minute testimony, like, here's where I was at. Here's what I used to say. Here's what I've done now. I feel great. And here's my E2 now. If people really want to know the blood levels, even though I think it's stupid, show them. Show these guys where their E2 blood levels are 80 and 90 and they feel fine. Because it's following.
They'll come in and they'll say stuff like that, and then I'll send PMs like, watch this. The guy's going to say, I'm on 250 milligrams once a week. Just watch. Or 200 milligrams once a week. And then they say, I'm taking injections once a week. There you go. There's your problem. It's not estrogen. Your protocol shit.
Yeah.
Just change this, and call me in 8 weeks. And sure enough, like, oh yeah, I didn't need the air anymore.
It is. It's they're on testosterone plus, the HCG once a week or something weird where they're spiking these things, or they're also taking DHEA and they're taking DIM and they're doing 6 different things at once, but they got to blame estradiol.
The funny thing I find is the guys that say, I don't believe in AIs. What I believe in is I'll lower my dose and I'll adjust my protocol to prevent aromatization or to bring it down. And I'm like, you're still doing things with that as a concern, as if that's the problem, and it's not the damn problem.
That's right.
It's not. And it's like, oh, you just explain it. And yeah, we gotta have to do a montage of everybody films themselves for 30 seconds saying what they did, what it changed for them. And just maybe if we got like, at Christmas time, you have that fireplace video on YouTube that plays for like 12 hours.
Yeah.
Have like a 12 and you're forced to watch it until you say like, okay, I got it.
I'm going to have you sitting in front of the fireplace as an intro in a Santa suit, and then it'll be great. But no, guys need to know they've got to research this stuff. And I'm not saying I'm the world's leading expert on this stuff. I don't think anybody's taken the time like we have to delve into this side of it because people just aren't that interested. But when you look at the research, it's all there. Like you add it all together and you go, there's zero reason that we should be blocking aromatase. There's no reason. I mean, just look at the papers on aromatase in the brain alone and the benefits of aromatization, you know, in the brain, just alone.
Yep.
Why would you want to block that? Like, it's neuroprotective.
Nope.
Like, the body actually increases aromatase in times of injury. People don't understand that. It's beneficial. The body's trying to protect itself. Adipocytes, fat cells, if you look into why they make aromatase, it's not to make you fatter. It's kind of to do the opposite. It's like trying to like increase leptin and do all these things that are beneficial. So it's just, there's just so much misconception. And a lot of it, again, it's just from the estrogen being thought of as a female only hormone. And so, yeah.
Oh.
Got me worked up.
See, told you to get red. It's getting red.
No, that's my hematocrit, Danny.
Next one. TRT will solve all your problems. You'll be rich, you'll be beautiful, you'll be... No, it won't. By the way, the video I did just a couple days ago, I mentioned earlier about best TRT protocol, where I described what I think is the best way to approach, or the best strategies you can use to figure out what's best for you. I say at the beginning of the video, I'm going to talk specifically about dosing protocols, specifically about testosterone. I'm not going to talk about insulin resistance. I'm not going to talk about your diet. I'm not going to talk about your stress levels. I'm not going to talk about any of these other things. I'm just going to focus on this. Doesn't some guy come on and start saying, you're just talking about T, but everyone knows how important insulin is in diet. And I'm like, I just said that at the beginning of the video that I'm just going to talk about this one thing.
I watched it. You did say that.
I read like a couple lines. Whoever it was that wrote that, I deleted it like 2 sentences in because I realized you're a moron and hadn't even watched it. TRT will solve all your problems. No, and Jordan, you'll go on this, but there's so many things. As soon as you start delving into one thing, you know, I'm feeling like this, I'm feeling like that, I'm feeling like that. Oh, I've got low testosterone. Okay, let me bring my levels up. Then you begin to realize all of the other things that need to be done. Again, with the insulin resistance, with the way you eat. Are you getting any exercise? Reducing stress levels. Maybe you're deficient in some vitamins. Maybe it could be a whole, you know, thyroid optimization is huge. And this one guy was talking about thyroid optimization not being important. It is absolutely important, in particular for women. Dr. Breger, my doctor, was talking with him yesterday. He's saying probably 70% of his female patients need some form of thyroid optimization. So it's not just a matter of getting your testosterone levels up and getting your levels consistent, because that's already a huge thing. But once you get that and you say, hey, I still have this issue, I still have that issue, there's a whole slew of other things that you can be addressing. So that won't be a fix. There are plenty of guys out there that they take that and like, I feel great, everything's fine, perfect. Maybe they were already eating well and healthy and exercising and didn't have any issues with thyroid, you know, but there is a whole ton of things that got to be addressed. I don't know if you want to add anything on there.
No, I totally agree. I mean, I talk about that with patients. Even though I'm a urologist, I'm also obviously interested in lifestyle and nutrition. And so I talk to these guys at length about their insulin resistance. And even though I don't treat diabetes, I kind of try to help them understand what it is and understand the importance of diet and lifestyle modification. Sleep hygiene is huge. It's a huge deal. And people don't have good sleep hygiene. Sleep apnea, a ton of my patients have that. And I look at them and you can tell. I mean, their necks are this big and their bellies are out to here. And you go, you snore? Yep. You got sleep apnea? No, I don't think so. I'm like, have you had a sleep study? No, I don't want to do that. Go get a sleep study. Like, you need it. You need CPAP. Like, you're never going to feel better. I don't care how much testosterone you're taking. If you don't have a lot of this other stuff dialed in, thankfully, a lot of my patients, they do. They're coming in because they want to get healthier, and they finally have started realizing it. So they get on the testosterone, but they also start cutting their calories and working out. And I mean, it's just, you got to have that trifecta of exercise, diet, everything else in order. Like I say, thyroid if it's an issue, and testosterone just is just that little extra to optimize what it does, but it doesn't do everything. It does a lot, but it doesn't do everything.
And to all you guys who misconstrue a lot of the stuff I say in the forums or I say on this channel about raising your levels, everyone says, oh, Danny Bossa just wants to have all crazy super physiologic levels, blah, 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 blah. No, you would not believe the amount of times I've tried to raise my levels higher than my TRT dose. And sometimes for the first week or two, I'm like, ooh, I feel pretty good. I'm like, man, my libido's crazy, or I feel like this. But sure enough, you give it enough time and everything just starts. And I did it again recently, like an idiot. I tried to bring it up higher. I just wanted to see. So I wanted if I could find a way. And a couple of weeks, same thing. I had to stop all testosterone and let my levels come back down. And now, sure enough, I'm sleeping better and my libido's back to normal and I feel more. So more is not necessarily better. Okay. If you're trying more and you feel better, then great. You know, maybe you can try a little more and see. There's going to be a point that this is my dose. And if you go any higher than that, you're not going to feel good. So stick where you feel your best. I know where I feel my best. And if I go anything higher than that, the issues come back bad. So one guy said his endocrinologist would not prescribe testosterone due to the Hippocratic oath of doing no harm, but then offered Clomid.
That's laughable.
We talked about that earlier.
Yeah, there's no response there. That person just, they're not interested in health to say that. They're just not. So
no. I'm prescribed 100 milligrams every 2 weeks. 100 milligrams every 2 weeks. Okay, guys, two things wrong with that. If you're injecting yourself with enanthate, or actually pretty much with anything, if you're injecting yourself with anything every 2 weeks, you're doing it wrong. I don't care what your doctor is telling you. I don't care what you read on a forum. You are doing it wrong. You will never feel good. Injecting yourself every 2 weeks, forget it. Forget it, forget it, forget it. It's never going to happen. Forget it, okay? Bare minimum, absolute bare minimum is once a week. Bare minimum.
Yep.
And there are guys that do well on once a week.
A few.
The majority of guys I'm seeing doing well are at least twice weekly injections, at the least. Even the guys taking the long esters. Okay, so if you're taking a long ester and you're feeling great on a couple of weeks, then fine, but you are not in the majority. If any of you have any type of issues, do at least twice weekly injections.
Yeah, and you're not
100 milligram every 2 weeks is just not going to cut it either. That's 50 milligrams a week, unless you're in one of that 0.01% that can only take like a couple milligrams a day. Yeah. We're talking like that much out of the whole. It's not going to work. It's bare minimum 100 milligrams a week.
I agree. 50 milligrams a week is almost malpractice to me. You can look at that study we talked about where they give men the Bayesian study up to 600 milligrams a week, and one of the groups was 50 milligrams a week, I think. And they lost muscle mass, like they compared to the other groups that I think 125 a week maintained, and anything over than that gained. But I mean, obviously, it's not all about muscle mass, but that just tells you like. You're kind of going backwards by doing 50 milligrams a week. It's just, I've never seen
it all comes from the doctors who are saying, well, every man makes, 5 to 7 milligrams a day naturally. So it's like, 35 to 50 milligrams a week, but you can't use that as a.
Yeah, it doesn't work that way because we're not doing nature here. We're not pulsing, high, free testosterone into the system multiple times a day, like natural rhythm. So it just doesn't work the same. And you always see, and that's why I think guys they need higher levels on replacement to feel like they used to when they felt fine, and maybe their morning levels were lower then, but it's not the same thing. So.
Yeah, absolutely.
I agree.
Next stupid thing. High free testosterone is dangerous. Jordan, we're playing with fire and it's dangerous. It's a dangerous thing we're doing. Maybe this will be our last podcast because maybe one of us is going to drop tomorrow.
I would just need to see the data that is making them say that. I mean, what levels? Where did they get that? What study's been done looking at free testosterone cutoffs that might be dangerous? I don't know if they're looking at that study with the higher T to E ratio, maybe.
Yeah, because they were taking and they were dropping estrogen, causing the high ratio, and that we know causes issues.
Right. So that's a confounder there. So I just would need to see the data. I'm sure there is a level where, just like when we say you can be too high, where you feel worse. I know in the past when my free T has been a certain level, pretty high, I didn't feel as good as I did when it was in my good range. And so, but whether that's dangerous health-wise or not, I don't know. I mean, some guys are susceptible to androgens as far as hypertension, and that's usually a genetic thing. We posted a paper on that as well. So yeah, that'd be something to watch out for when, I mean, if you get your free T or any androgen, total T, whatever, free or total T too high, you may be sensitive to it. You may have blood pressure issues. I think that's the main thing we worry about. Main thing I worry about. I mean, obviously there could be some damage long-term on the heart if you got just too much androgen. I mean, just like guys with anabolic steroids, and those are androgens, especially the DHT derived ones. But we don't know. I mean, I don't know. There's no way that anybody can say that definitively. We have one good study on 600 milligrams a week for 20 weeks. Blood work stayed fine. Health parameters look fine. That's all we got. So
yeah,
we just got to go off, we got to go off what we know about testosterone and how it works. But again,
we also have a lot of studies about they're saying abusing anabolics. But guys, you got to keep in mind, are they abusing just testosterone, or are they taking nandrolone and winstrol and anavar and tren and all this other stuff?
Non-aromatizing substances.
Yes.
And blocking their E2 at the same time. You can't take anything from the bodybuilding world and then really extrapolate that to the TRT world. You just can't.
That's right. That's right. How some people think that anytime you've got an off day, or you're angry that day, or you have a little bit of an outburst, or you have an emotional reaction, that's because you're on that testosterone stuff. That's why you're acting like that. Yeah. So every time I get pissed off in the group, it's because of my high testosterone levels. No, actually, they don't say I'm on my high. They say Danny's E2 needs to be controlled. Danny needs an AI.
That's right.
No, I was. No, guys, if anything, and a lot of you might have a really hard time believing this, I'm way calmer. Believe it or not, on TRT than I was prior. When I was at low testosterone, man, was I on edge. Like I was like the short fuse, and I would blow up at just anything, and I was stressed, and I would snap at people. I'm actually a lot calmer now on testosterone, and I know you don't see it sometimes in the group, because sometimes I can see somebody saying something really stupid, and I jump all over it because I don't want anyone else to believe what they're saying, because I know it's wrong and I can demonstrate it. But yeah, I've gotten that even with my wife, frankly, when I started on TRT and we had our first little fight. She goes, I wonder if it's the testosterone making you think this way. And it's like,
I hear that all the time from people, or from mainly wives. They're worried about if their husband's going to get on testosterone, if he's going to become a roid rager and all this stuff. It's just myth. You are who you are, personality wise. So if you're a jerk before TRT, you may still be a jerk. You may be a calmer jerk. I see guys who have told me once they got on TRT, their anxiety went away. I had a guy tell me if I had been on TRT 5 years ago, I wouldn't have gotten a divorce. And people who say, my friends at work notice how much calmer I am or nicer I am when I'm on my testosterone. I'm like, yeah, absolutely. Low T and low E2 cause all kinds of mood instability. And they can cause depression and anxiety. And that's why a lot of these guys we see that have depression and anxiety need to be screened for low T before they're ever offered an antidepressant. That's a big soapbox for me, and I see it all the time, and it really frustrates me how people don't realize that mood is improved more often than not if you truly need to be on testosterone. Your mood will usually improve, especially after that break-in period. Yes, early on, that first 6 week, 8 week, it can be weird. That's with everything. I mean, your body's just got to get used to things. But once you get stabilized and things have taken effect, you feel better for the majority. And you're still going to have a bad day. I mean, that's what you can ask Sean Ramsey in the group. I hammered him because I got him off his AI. And he's like, oh, okay. I'll stop the AI, but I'm going to keep doing my mood journal. My doctor told me, to keep a journal of my mood every day. And I told him, I said, Sean, you need to throw that mood journal away. Like, you're never going to feel better if you're journaling how you feel every day, because you're going to look for reasons hormonally why you might feel a certain way. And that's just feeding into that. And he did. He threw it away, and he's great. You can ask him.
Yeah. It's amazing how people just focus on the bad. Oh, you're angry, this or that. What about the good? Like, I've had a business for 17 years. I've been on TRT for a little over 4 of those years. In a little over 4 of those years, my business has grown by 600%. And it's just because I finally have that drive and that motivation. I feel good about myself. I have confidence. I don't have that anxiety. And that did everything. like that. This TRT for me was like a lifesaver on a
Absolutely.
relationship side, on just a personal, the way I felt about myself side. So there's so many benefits, and I find there's so many people, they focus on the bad. Yeah. Oh, I could maybe do this, or you might get gyno, or you might retain some water, or you might. What about the good? What about the good? There's a guy that commented. He says, "Oh, Danny's, his protocol is off. Look at his face. His face is bloated. He's retaining water." Huh? What? Where's the water? It's like, I don't know where they come up with this stuff. They pull it out of their ass because they got nothing else to say or nothing to contribute, and they just say the dumbest stuff. And I read it and I laugh. I don't know.
The whole side effect thing, I don't see it. And I post this all the time to these gurus that come on, or these people that say TRT has all these negatives. Testosterone's dirty. It's a dirty molecule. Bodybuilders love saying that. Testosterone's dirty. I don't see it. And I always say, why is it my patients as a whole, I don't see these bad side effects. I don't see gyno for sure. I don't see raging. I don't see much of any. I've got two personal patients right now that have some acne issues. 2. That's it. I'm trying to think. One of them's already getting better. He's just had to ride it out. And estrogen issues, don't see them. My guys don't even tell them about estrogen. They never come in with high E2 complaints because they don't know.
They don't know what it is.
They're good old guys around here. They don't care. They just want to feel better. I'm trying to think. Blood pressure issues, very rarely. Every now and then, it's usually with cream, and it's usually just in like the first month because it's in your system so fast. They may be going too high because some of that stuff's potent, or they're absorbing it really well. Their blood pressure will shoot up, and we back them down on the dose and then slowly titrate back up over time, and they're fine. So yeah, blood pressure would probably be one. Water retention, yes, it's expected in the first month or 2 with TRT. It just is. Mm-hmm. I see it more with the cream than with injections, again, because levels seem to get higher and it's in your system quicker. Testosterone injections take a while to reach steady state. Cream, like 1 day on it, and it's in your system. So anyway, I just don't see these bad side effects with patients. And I just feel like most of the time it's because guys have been given crap protocols. I mean, honestly. And that's what I see when guys come see me and they're like, yeah, I was on testosterone years ago. It just never worked. I'm like, well, what were you on? I had 1 injection a month. Okay.
That's why
you had side effects.
Guys, you got to keep in mind also that you think of how many people just in North America alone are on TRT. And it's probably a lot more than you think. Now, what is the fraction of those guys that are in these Facebook groups and TRT forums? Like 1% of them, if that, probably not. Why? Because most guys show up at Jordan's place, they get their TRT and they go, and they don't know about any of these things that we're talking about, E2 and DHT and this and all these. They don't. They like, oh, I feel better. Oh, great. And they just go, and they're not analyzing stuff to death. It just works for them, and that's it. It's that small little fraction of that regular thing isn't working. Let me see if I can figure something out more. And you need a little bit more dialing in. Those are the guys that come up in these groups. But none of these guys are often taking any type of AI unless they're seeing a doctor that just gives an AI to all of them and they don't know better anyway.
Yeah, if they're doing a lot of the telemedicine more than not, and there are good telemedicine clinics, obviously. I promote a couple of them in our group, but as a whole, they're usually just all the same. Not just telemedicine, but these HRT clinics, TRT clinics, that's all they do. They're cookie cutter. Here's your testosterone, here's your HCG, and here's your AI. See you later. And people never see a doctor. They'll come see me. And they're like, I've never seen a doctor there. And if I call with an issue, either give me a nurse or PA or whatever. And they're like, oh, you need to increase your Arimidex. And that's all they say. I mean, it's just.
And they infuse it into their oil to inject.
Oh, gosh.
I see that and I just want to scream. It must be my TRT dose that's making me want to scream.
It must be.
The AI is in the injection. They're injecting the AI. Oh, horrible. Guys.
Honestly, horrible. And I'm not going to call it malpractice, but it's not appropriate.
Can I call it that? I'm not a doctor. Yeah, it's malpractice.
It's poor practice. Let's say that. It's very poor practice.
Poor practice. Yeah.